Being a college athlete and learning about OCD made me realize that sports may have OCD present within them. Whether the player is at the free throw line doing the same routine every time or the pitcher is carrying out the same mechanics every time he throws made me wonder if these superstitions were considered OCD. Take, for example, this athlete. He has to make sure that he holds the ball the same way every time, and the ball must be placed in the same spot with the laces facing the same way every time. This example may lean more towards OCD, but let's find out first exactly what OCD is. OCD, or obsessive compulsive disorder, is an anxiety disorder in which people have repeated thoughts, unwanted feelings, or ideas, also known as obsessions, or behaviors that make them feel compelled to do something, also known as compulsions. The person will carry out the specific behavior to get rid of the obsessive thought, but this only provides limited relief. Not performing the obsessive rituals can create tremendous anxiety. OCD can be anywhere from severe to mild, but if untreated, it can destroy a person's capacity to function at school, work, and even in everyday lifestyle. OCD affects about 2.2 million American adults, and the problem can be accompanied by other disorders such as anxiety disorders or eating disorders. It generally equally affects men and women the same and usually appears either during adulthood, childhood, or adolescence. Up to one-third of adults with OCD develop symptoms in childhood, and recent research indicates that OCD may even run in families. Also, with OCD generally appearing in early adulthood or teen years, recent studies indicate that the disorder can even be traced back to as early as childhood. Studies now indicate that at least one-third of the cases of adult OCD began in childhood. According to the DSM-5, obsessions are defined by recurring and persistent thoughts, urges, or images that are experienced at some time during the disturbance as intrusive and inappropriate, and that in most individual cases marks anxiety or distress. Compulsions are defined as repetitive behaviors, for example, hand-washing, ordering, or checking, or mental acts, for example, praying, counting, or repeating words, that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. Examples of obsessions could include a person cleaning a dish and thinking, "This dish isn't clean enough, I need to keep washing it," or "I may have left the car door open," or "I know I forgot to turn off the PlayStation." These thoughts are demanding and produce a heavy load of anxiety. Other examples of obsessions could include troubling sexual feelings or being afraid of germs. In response to the obsessions, people with OCD cope with repetition called compulsions. The most common compulsions are washing and checking. Other compulsive behaviors can include hoarding, counting, and rearranging. Some people with OCD have set in stone rituals or perform the same activity over and over with the same exact way to get rid of the anxiety, but this is only a temporary fix. For example, the baseball player who kept putting the ball on the tee and hitting off the tee the same way is only a temporary fix to his anxiety, but could be an example of a compulsion. Symptoms of people with OCD often include having repeated thoughts or images about many different things, such as the fear of germs, or dirt, or intruders, violence, hurting loved ones, sexual acts, conflicts with religious beliefs, or being overly neat, doing the same rituals over and over again, such as washing dishes, locking and unlocking doors, counting and keeping unneeded items, or repeating the same steps over and over, having unwanted thoughts and behaviors they can't control, not getting pleasure from the behaviors or rituals but brief relief from the anxiety that causes them, spending at least an hour a day on thoughts and rituals which cause distress and get in the way of daily life. Most people who have OCD can recognize their condition and are able to refrain from it from conflicting in their everyday life. It is when the condition becomes serious is when it starts interfering with their everyday lifestyle. The disease is quite broad and symptoms may flash here and there. The symptoms may appear at one stage and ease on the other, but when the condition becomes most serious is when people use coping mechanisms such as alcohol and drugs to relieve them of anxiety. Of these symptoms, you can look at more specifically the biological, psychological, and environmental factors. First, let's take a look at the biological factors. Of the biological factors, it can be broken down into regulation of brain chemistry and changes in brain activity. Research of the biological causes and efforts of OCD has revealed a link between OCD and insufficient levels of brain chemical serotonin. Serotonin is one of the brain's chemical messengers that transmits signals between the brain cells. Serotonin also plays a role in the regulation of mood, aggression, impulse control, sleep, appetite, body temperature, and pain. All of these medicines used to treat OCD raise the levels of serotonin available to transmit messages. Also, changes in brain activity are related to the biological factors in OCD. There are two main areas in the brain that are related to OCD, the caudate nucleus and the prefrontal orbital cortex. And the caudate nucleus is important because it is managing habitual and repetitive behaviors. When OCD is successfully treated with drugs or therapy, the activity in this area of the brain usually decreases. This shows that both drugs and a change in thinking can alter the physical functioning of the brain. With the prefrontal cortex, the level of activity in the prefrontal cortex is believed to affect an appropriate amount of social behavior. Lowered activity or damage to this region is linked to feeling uninhibited, making bad judgments, and feeling a lack of guilt. More activity may therefore cause more worry and social concerns. Such concerns include being meticulous, neat, and preoccupied with cleanliness, and being afraid of acting inappropriately. All these symptoms are related to OCD symptoms. Psychologically, past research believed that OCD was a result of life experiences, but more recent research suggests that varies due to biological factors and psychological factors. The fact that OCD patients respond well to specific medications that affect the serotonin suggests the disorder can be neurological. Because of that, OCD is no longer attributed to just the thought of life experience and the ability to think if something is clean or not. OCD is often accompanied by other disorders such as eating disorders, personality disorders, or depression. If OCD coincides with another disorder, it may become even more difficult than it already is. Recent studies have also suggested that other illnesses may be linked to OCD. These illnesses include trichotillomania, body dysmorphic disorder, and hypochondriasis. Trichotillomania are the repeated urge to pull out or scalp hair, eyelashes, eyebrows, or other body hair. Body dysmorphic disorder includes excessive preoccupation with imaginary or exaggerated defects in appearance. And hypochondriasis is the fear of having, despite medical evaluation or reassurance, a serious disease. Thirdly, environmental factors are proven to show that they do have some relation with OCD. Daniel Cates studied the relevance of twins with OCD and environmental factors. Yes, his study had limitations, which his sample size was small, and there was a large amount of tests done, but he did conclude that the study was really the first attempt to identify characteristics of the environment associated with OCD symptoms in a twin study. He said that these parent data suggested the symptoms in the high-scoring twins of the discordant group are likely to be the consequence of the moderate genetic vulnerability to the OCD pathology in addition to interacting with environmental mediators. So that being said, there are environmental factors relevant in OCD. Overall, there are many core symptoms and factors related to OCD, but now let's move on to treatments. Treatments with OCD can be broken down into two categories: medications and therapy. With medications, recent trials have shown that drugs can be effective in the treatment of OCD. Of drugs that can be used, SRIs or reuptake inhibitors and SSRIs or selective serotonin reuptake inhibitors are proven to be best. A significant amount of studies have shown that more than 3/5 of patients have been helped by taking medications. If the medication does not respond well to the patient, then he/she will always have the option to continue and take another SRI for a better result. This results in a higher success rate for medications in OCD. With behavior therapy, cognitive behavior therapy, or CBT, has been shown to be the most effective type of psychotherapy for OCD. This type of therapy can be tedious and risky, but multiple studies have been done, such as the Pediatric OCD Experiment and Clark's study on cognitive behavioral therapy. CBT includes introducing a patient to a situation that will arise his/her obsessive behaviors and then teach the patient to slowly tolerate the anxiety. With more CBT being done, the less anxiety will occur and the patient will eventually get rid of his or her OCD. Now, obviously, medications and CBT will not work for every single patient, but these two types of treatment have proven to provide the best and most successful results for treating OCD. Still, some studies need to be done on OCD to clarify some problems. When, according to Cates, he assumed environmental studies on OCD are still not clear. Future studies need to study the differential effects of environment and genes on phenotypes, and to also study the nature of the interplay between genes and the environment. This will help clarify the environmental factors and their success and impact on OCD. Also, there are more effective ways in treating OCD. For example, stress managing techniques and meditation could be one way of treating OCD and anxiety. Also, turning to a person's family and having people who you're close with to talk to can also help with anxiety disorders. Recent studies have shown that most people with anxiety disorders benefit from talking to people or their closest friends. Overall, the medications and CBT have shown to be very successful in treating OCD, but still more treatment needs to be researched and more effective way needs to be done in order to completely help every patient with OCD. Thank you for watching my video, and I hope you learned a little bit about OCD.